phone rings, and it's my wife's grandfather. He's calling because he's at the hospital. My daughter, she's sick. It's her kidneys, and it's bad. Hi, I'm Brian Phillips. The year was 1996, and following this, she was in and out of the hospital. She had batteries of tests done that were inconclusive. Finally, it was recommended to us to take her to the Children's Hospital in Los Angeles. There, they found the problem. She needed surgery and she needed it quickly. We had insurance, but our insurance wouldn't cover the procedure. We didn't know what to do. It was very expensive. We were really upset. Then the Children's Miracle Network stepped in. Without us asking, they paid for the surgery. We never had to fill out anything. They never asked us for anything. It's because of that my daughter can still be here today. Marissa? It's because of this and the research that I have conducted into the Children's Miracle Network that I'm credible to speak to you all today. I'm going to tell you about this great organization that saved my daughter's life. I'm going to tell you about the great people behind the organization, and you're probably going to recognize some of the names. Then I'm going to tell you where the organization is today and how they've saved the lives of more than 10 million children who were injured or sick. And then finally, I'm going to tell you how it's going to be your mission to help save these children's lives. The information is available on childrensmiraclenetwork.org, published in 2017, even their financial data. Without the help of people like you to support this organization, millions of children will suffer, and they will not receive the care that they so deserve. But by your help, just donating $1 at a time, they can continue to save children's lives. Children's Miracle Network has worked hard throughout the years to help children and save their lives. This is how they started. It began in 1983 with a telethon. Marie Osmond, John Snyder, Mick Shannon, and Joseph Lake founded the Children's Miracle Network. At the time, there were only 22 children's hospitals. 20 stations aired the broadcast. They had 6 sponsors and just a handful of staff. They had one goal. Their mission was to improve the lives of as many children as possible. And they did just this. They raised $4.8 million for those partnered children's hospitals. Off to a great start in 1983, the Children's Miracle Network has grown so much. Now Children's Miracle Network is partnered with more than 170 children's hospitals. They have more than 40 partners. The partners include such organizations as Walmart, Costco, Rite Aid, Dairy Queen, and many others. Partnered together with these organizations, they have one mission: to help sick and injured kids in local communities. They provide more than 32 million medical treatments each year across the United States and Canada. In 2017, John Locke, the CEO of Children's Miracle Network, said 62 children enter a Children's Miracle Network hospital every minute. That's one child every second. That means in the time that I'm going to give this speech, 400 children are going to get sick and enter a children's hospital. Most of the donations are raised in the stores using the balloon icon. You've probably seen this in the store. It's the balloon. They ask you if you want to donate $1 to help children that are sick. Since 1983, Children's Miracle Network has used this to raise more than $5 billion to help children. And the partners who collect the donations are a key to the success as well. The employees are really into collecting donations to save children's lives. Since 1987, Walmart, one of the largest contributors to the Children's Miracle Network, they have raised $1 billion for this cause, according to Walmart's Senior Manager of Corporate Communications, Erica Jones, in a 2016 interview. These partners take it serious, and they are not doing it alone. It also takes people like you who are willing to donate. It's a partnership to help save children's lives. Well, now that we saw where it started and where it is now and how excited the partners are to help, let's take a look at another life besides my daughter's that was touched by the Children's Miracle Network. In a 2017 article by Beth Harris titled 12 Hours, 40 Miles, and One Giant Heart for Kids, It tells the story of Joe Spiegel and his nephew Matthew. Matthew had a sickness that most children born with don't live past 1 year. Matthew's now 20 years old, thanks to the Children's Miracle Network. Joe, seeing this, he wanted to pay it back, so he decided to raise money for the Children's Miracle Network. He decided to try to do a 40-mile run in 12 hours. His goal was to raise $5,000. He actually ended up raising $5,600. $5,600. $600 more than his goal. He only made 36 out of 40 miles, but that is really a lot. And, I mean, for a good cause such as the Children's Miracle Network, it was worth it. Because, you know, when a child's sick, the whole family feels it. It makes sense to me that so many would be behind the Children's Miracle Network, with them doing so much to help our most important assets, our children. Since the 1983 telethon, the Children's Miracle Network has helped more than 10 million children that were sick or injured, and has been able to help them with more than 32 million medical treatments. And Matthew and my daughter are just two of the countless lives affected by the Children's Miracle Network. They do this $1 at a time. They do this with the help of their partners and through the generosity of people just like you. And they're only asking for $1 at a time. Without the help of people like you, this foundation of miracles, they wouldn't be able to help the millions of children they are able to help now. And those children would suffer. And nobody wants to see children suffer. Do you? According to an article written by Ricardo Alonso Zaldivar in 2017, healthcare costs will rise by more than 34% on the most popular health plans. It's times like these that $1 at a time really matters. With your help, by donating just $1 at a time and spreading the word, they can continue saving children's lives. I'm Brian Phillips. Please donate.